Well, good afternoon. We are having, again, great success at moving our residents through the TCF Center. We can run at very good volumes and accommodating all of the individuals in the eligible groups. And we're here today to announce another significant expansion of eligibility for individuals to come through TCF. So I'm here with Christopher Samp, the director of the City of Detroit's Office of Disability, and of course Denise Fair, our health director. But today we are going to move significantly to open eligibility at TCF for the intellectually and developmentally disabled community. Denise, does your clicker work? Mm-hmm. Wasn't. Thank you. Okay. So today, we are opening eligibility to Detroiters 18 or older who have an intellectual or developmental disability. Anybody whose disability makes them more vulnerable to contracting COVID-19. And that means individuals with conditions like cerebral palsy, autism, Down syndrome, muscular dystrophy, fetal alcohol, spinal bifida, hearing or vision impairment, Tourette's, ADHD. These would be examples of the kinds of conditions that we're going to treat. And we think the reason for this is overwhelming. Both Christopher and Denise have been pushing from the beginning on our commitment to the disabled community. And I've had some moms I've been communicating with from Detroit who have adult children either with Down syndrome or cerebral palsy. When you look at the research, the United Kingdom did a study last fall. Individuals with Down syndrome are 5 times more likely to get COVID than the population and 10 times more likely to die of COVID. Even the CDC website says that individuals with Down syndrome are more at risk. On cerebral palsy, there's a good deal of research out there that those individuals are more at risk. On autism, you can understand that individuals with autism have behavioral issues going to make it very difficult to socially distance and wear a mask. And Temple University just published a study indicating that individuals with autism are dying from COVID at higher rates. And so we believe that it makes sense to move forward with this group. All right. So we're having a lot of trouble with this. So let me talk to you about the steps that we have taken so far. With the leadership of our health director, on January 28th, we made eligible individuals working in home health care settings. Up until then, our healthcare workers at hospitals had been vaccinated, but we had a lot of individuals in home situations, whether they were paid or unpaid, who couldn't get a vaccine. So starting in January 28th, we opened TCF to those home healthcare workers. The second thing we did was take the next most vulnerable group, those with disabilities who are in adult foster care homes. And those individuals are in such close quarters that the potential for COVID to spread within those facilities was extremely high. And so we sat here 2 weeks ago with the Detroit-Wayne Integrated Health Network leadership and said, just as we are going into senior citizen centers and into homeless shelters, we have started going directly into the adult foster care homes. Those are our disabled most at risk. And then on Tuesday, we took the next step. And we now have a contract for round-trip transportation for $2, including wheelchair accessible transportation. So now we have got the ability to take this step. And so today, if you call our number, which by now everybody knows, 313-230-0505, and you have any of those conditions, you can book an appointment. We will get you in next week. So when you call, tell the operator the condition of the individual, what is the intellectual or developmental disability. When you show up at TCF, you're just going to have to give some verification of the condition. It could be a note from a healthcare provider, it could be your prescription bottles, it could be an insurance record, or any other documentation. But just show the folks at TCF when you pull up a verification of the condition. And we're adding one more thing. If you're a Detroiter who's a caregiver and you're in the car, you can get a vaccination too. So, but you have to call up and make your appointment together. So if you call today for both an individual with a disability and you yourself are also a Detroiter who's a caregiver, as long as you come in the same car, you can both get your shots. And again, the logic of this to me is obvious. The vaccines are 95% effective, but caregivers and these individuals are in such close contact all the time that it's extremely important that both are protected. And so there have been 4 states in this country that have now moved beyond the other standards to allow these individuals to become vaccinated. We are going to join those 4 states, Ohio and Maryland and New Mexico. We are going to join them today, and I'm hopeful that the rest of the state of Michigan will catch up soon. But what I know for sure is we've got the capacity at TCF right now to support our most vulnerable individuals. And so we wanted to be a leader on this issue. And at this point, I want to introduce this community to a man who has been just a tremendous advocate to make sure that the disabled community is not forgotten in our COVID response, the head of the Detroit Disability Office, Christopher Samp.
Thank you, Honorable Mayor Duggan, for introducing the new Office of Disability Affairs. My name is Christopher Samp. I'm thrilled to be here today to share about me and the goals for the Office of Disability Affairs. I'm a Michigan native. I grew up in the suburb, and I went to Rochester Institute of Technology. I got my bachelor's and master's degrees in public policy. I carry over 20 years of work experience in higher education, nonprofit, and the legislative government. So I'm excited to be back home to serve in this role and to support people with disability, making sure that we have accessible housing, employment opportunities, improved transportation and road conditions. So we are here to support you and making sure that we make Detroit accessible. So regarding to COVID-19, we will be working with our community partners and making sure that we strengthen and provide access to the people with disability. So if you want to connect with me, my email is here, it's disability@detroitmichigan.gov. So I look forward to working with you, and thank you for the introduction, Mayor Duggan.
So Christopher has already had a huge impact in a short period of time here, and he will respond promptly if you email him, but he's very much involved in every aspect of the planning. I was really pleased now that Denise Fair's outreach team, which has been so outstanding, is now getting out to our adult foster care homes and to report on the progress that she's made and the plans going forward. Director Fair.
Thank you, Mayor. So we have heard from a number of organizations in the disability community, and we agree that we have to do more. So here's what you asked us to do. You want us to prioritize vaccination to all facilities that house people with disabilities. You also want us to prioritize vaccination of caregivers who care for people with disabilities. We have read your letters, and we do recognize a strong need to protect people with disabilities, especially during COVID-19, because they are at a greater risk. And as the mayor did indicate, we will be providing direct access to Detroit residents with intellectual and developmental disabilities because we are committed to ensuring equitable access to this vaccine. So let me share with you the work that we have already done in the community and also our plans for the future. So the health department is already at work. As the mayor mentioned, in January, the vaccine was extended to home healthcare workers. And just 2 weeks ago, we announced that we are partnering with DWIN to vaccinate residents and staff in mental health facilities, substance abuse centers, and adult foster care and group homes. And now we are partnering with Wayne Health. They're providing their mobile units to extend our outreach into the community. And as additional sites are added, they will be screened for ADA compliance. I do want to personally thank the leadership at DWIN and Wayne Health for being committed to these ongoing efforts and helping us as we expand to other locations within the community. I also want to thank Dr. Iris Taylor and her team for organizing this very important work. So yesterday, we vaccinated 188 people at the Northeast Integrated Health Network. Today, we are going to Southwest Counseling Solutions, where we've already pre-registered 176 people. Tomorrow, we're going to 5 facilities and plan to vaccinate over 200 people at the Amherst Homes, Share House, Sobriety House Incorporated, Detroit Rescue Mission, and Children's Center of Wayne County. And I just want to share some initial feedback that we've already received. The residents are overjoyed. They are pleased that we have prioritized them. Some of them were even crying. They were just so glad that we were there to help support them. They were very impressed with the quick flow and the turnaround and also the overall process. So we will continue our partnership with DWayne and Wayne Health over the next couple of months as we aggressively vaccinate this community. And so with that, I'll turn it back over to the mayor.
So, great job at reaching out. So we're now 400, 500 people a day between our senior citizen centers, our adult foster care homes, and our homeless shelters, that the staff of the Detroit Health Department are out delivering vaccines on site. It's just a great job. And with that, we'll take any questions.
Okay, Mayor, just a couple questions. One from Christina Hall at the Free Press. She said that FEMA announced today that the city is to receive $18 million for costs related to its COVID-19 response, and that it's an advance payment to the city for eligible reimbursements. And she wanted to know if we have any, if we're aware of it, and if we have plans for how that funding would be used.
Well, we're going to pay the city back for what we're doing. So I did not wait to figure out the bureaucracy. We rented the TCF Center, we hired the staff, and we have been running the operation. My understanding is the regional director of FEMA was in this week, and Hakeem Berry took him on a tour, and he has now reached out to us for the manual for the way the city of Detroit is running the TCF Center. He said it was absolutely remarkable that we were running a location where we were giving second shot Pfizer vaccines in the same location as first shot Moderna vaccines. And that's no small challenge when you're moving 3,000 plus people through a day. But our regional director was extremely impressed with what he saw, and then let us know we would be getting $18 million, which makes our finance folks very happy. I was confident we would get reimbursed at some point. I think what President Biden is doing is, in the last cycle in March and April, the very complicated reimbursement formula through different agencies. And I think what the White House is doing now is saying we're going to make this simple. It's all going to go through FEMA, and at least so far it looks like it's working well.
Okay, great. And for Christopher, wanted to know if you might want to speak a little bit more to your past experience and what plans you might have or what you're looking at doing in your new role at the city.
For the vaccination plan.
Okay.
So with the vaccination plan, we're taking a huge step to making sure that access for people with disability and at the TCF Center, who have provide interpretation and braille services. And we are also making sure that we have accessible transportation for people in wheelchair. I know that City of Detroit is making a big step in counting data of people with disability receiving vaccination, and that's huge. There's not a lot of other city or county government that track people with disability, and so that's really important to count and include them. So, well, thank you, Mayor Duggan. So.
I can tell you for sure, one skill Christopher has is the PowerPoint. So his first week on the job, he did a PowerPoint presentation on his plans for the Office of Disabilities that left us all in awe. So I'm going to be getting some tips on how to improve my PowerPoint presentations from him.
All right, that was actually our last question for today.
All right, thank you very much.